I will insert photos of, damn it, that means I have to shave. I didn't think about it, but I'm probably going to have to like shave. I'll just shave those parts of my leg. Is that like, whatever. Hey, what's up, loves? Shatecehaynesmedia Haynes here. Welcome back to my channel. And for today's video, today's video is going to be a little bit personal. A few months ago, I did a video on a skin condition I have called Hidradenitis Suppurativa. If you guys haven't seen that video, I will go ahead and link it here and then link it somewhere down below in the description box. So a few months ago, I did that video. I got so much love and support from that video from you guys, and I just want to take a minute in this video to say thank you. It felt really, really good to get that out, to hear your guys' feedback, to hear your guys' stories, to get help from a lot of you guys who had tips about home remedies. A lot of you guys told me to join Facebook groups, which I also did, and that helped so much. I learned a lot, and it actually helped me want to get help with my own condition, which started having some issues later down the road. I'll get into all of that. If you haven't seen that video, just a really brief description. Hidradenitis suppurativa is a inflammatory skin disease where you develop cysts and boils and lesions and things like that. Typically, people get this in areas of the body that rub together. So a lot of people get it under their arms. People have it under their breasts, the groin area, the buttocks area, all of that. I have HS under both of my arms, and then I have it on my left leg. I didn't show this in the last video, honestly, because I was not thinking about it. It was a very spur-of-the-moment video. I just pulled out my camera and started filming and just wanted to talk about it. I will insert photos of, damn it, that means I have to shave. I didn't think about it, but I'm probably going to have to like shave. I'll just shave those parts of my leg. Is that like, whatever. Anyway, just because I did show what the scarring under my arms looked like in the last video, I'll go ahead and include a couple photos of what the HS on my leg looks like. I'm going to be showing images of like wounds and like HS stuff, kinda. But if that is so not your thing, totally fine. It's not, I don't think it's too graphic at all, but when I uploaded my last video about HS, a lot of you guys had questions about my experiences, wounds and things like that. There will be images of like, not like gross stuff, but like wounds and stuff, if that bothers you. Just putting that out there. Anyway, with that being said, I wanted to update you guys on just how my condition has been and what's been going on lately. Back when I did my first HS video, it seemed like it was fine. It was just a lot of scarring. It had gotten progressively worse since then. Well, it hadn't gotten really worse since then. It had been bad, but I just wasn't having a lot of drainage. It seemed like it was in a much better place, but my HS has been really bad for years. I think what had brought it to the point where I needed to get surgery was that I'd had a lifetime, basically, of just unhealthy habits, unhealthy eating habits, a stationary lifestyle, really bad blood sugars. Once I found out that I was diabetic, I had a really hard time keeping my blood sugars leveled. And then I think what most recently may have definitely brought it to this point was just the way I was living my life the past year, kind of, when I was working late night shifts in warehouses, which is kind of not the healthiest lifestyle to be living. And I think just all of those unhealthy habits, just the way I was living my life, also the foods I was eating, specifically so many fried foods, and just years of that for the most part, led me to where I was today. When you have HS, typically the more scarring you have, the worse it gets over time, because that scar tissue becomes damaged. And at least in my case, what started off as another boil just kept growing and did not heal. And I've had boils that had drained for months, but this was going on for months, like a long time, and it wasn't healing. Something just had to be done about it. Needless to say, the last few months of 2018 were a little bit miserable. No, it was a lot. I'm not gonna lie, it was a fucking lot miserable, okay? And because the swelling and just the pain had gotten just out of control, so I decided to start seeing a surgeon. I started seeing the surgeon back in September. So we tried different medications, different antibiotics. Changes in my lifestyle have helped a little bit, but at the same time, like, the damage had kind of already been done. There was so much dead and diseased scar tissue that needed to be getting that needed to be taken care of. So after a few months of things, and honestly, my body was so tired of being on antibiotics. I was so done with being on antibiotics because I'd been on them for months, and it was kind of wearing on my body. So, not like months straight, by the way. I don't want to say that, but like I'd been on and off of medications and antibiotics for months, and nothing was sticking. I was on medications, like I would take an antibiotic for like 10 days, and the wound would like damn near close. And then as soon as I fucking got off of it, then the wound started opening again. And my body just was not healing itself. So then my surgeon and I decided that we would just get surgery done. So the idea for the surgery was to do a skin graft. Essentially, he wanted to cut away all of the dead scar tissue on this arm and replace it with a graft. I think we were going to use a skin graft like from my leg or something at first, but we ultimately decided that they would use a synthetic graft. The synthetic graft ended up working a lot better, and it's healing very, very nicely, which is I'm so fucking happy about, because I don't know why. For some reason I was expecting everything to go wrong, but it didn't. It's been a really good process, and I don't know why that surprises me, but it has been. I do want to talk a little bit about the surgery process, the pain process, and the healing process, and how that's been. The surgery process was really surprisingly smooth. The surgery itself was a excision right axillary hidradenitis with synthetic graft placement. The nurses beforehand told me that the surgery typically takes about 45 minutes to an hour. Just because of the size of the wound, they said mine ended up taking about an hour and a half, so not too far off, though, for how long it normally takes. So all I remember, honestly, is I remember being extremely nervous just because I had never had a surgery before. So I was really nervous, but I remember being in the OR. I remember I blinked a couple times, and then I woke up in recovery. I do not remember anything else. But yeah, it was really smooth. I woke up. I was in recovery for about maybe 20, 30 minutes. And then they sent me like a take-home pamphlet thing, like a list of instructions or whatever that's called. And then I went home. And I was heavily bandaged on my right arm. I wasn't allowed to touch the bandages until my next visit, which was about 4 days later. So I couldn't do anything, shower, anything for about 4 days. Sponge baths got real tiring. And that was it. I spent most of the time at the hospital just in my room waiting for the surgery because it got pushed back a little bit. But yeah, other than that, it was a really smooth process. I was, for the most part, in and out. I really wasn't in much pain at all when I left. The only thing that hurt was the throat from the fucking thing they put in your throat when you go under when they have surgery. So that was the surgery process. Really smooth, really easy, does not take long. But yeah. So I'm going to go ahead and insert a picture of what the wound looks like now. It looks a lot worse than it feels. The skin and everything is very pink. There's no sign of infection or anything. So far, it's been a really good healing process. It's just going to be a long one. Pain-wise, it has not been anywhere near what I thought it was going to be. It's sure as hell is nowhere near as painful as having a cyst. I feel like by them like almost cutting away the disease kind of helped so much. The only pain I remember having was the first couple times I had to change the dressing. It was a little painful just because the gauze kept snagging on the stitches. There's been a little bit of like pulsing pain from the stitches, but other than that, nothing more than like a normal, I want to say nothing more than a normal wound healing, but that varies from person to person depending on tolerance and things. I don't consider myself someone to have a high pain tolerance, if that puts it in reference for anyone. I feel like having HS over the years, has kind of built up my pain tolerance a bit, but I'm still a baby about pain, and I haven't really felt any. So just to put in perspective, it has not really been a very painful recovery really at all, except for when I try to use my right arm, then it hurts, but obviously you're not supposed to be doing that. So the plastic material really, really helps it not hurt when unpacking the wound, because it creates a barrier between like flesh and everything else. So packing the wound has been has gotten easier. It just took getting used to, really. Eventually you get better, you get faster at, packing the wound. You find the most efficient ways to pack it. You kind of learn how to like Jedi samurai yourself in, ways that you can like, effectively like pack it the way that's comfortable for you so you can still move. Which is surprising. I kind of thought I would have like no movement at all. I don't know what I thought this surgery was going to be. It seemed like I thought the surgery was going to be like terror or torture or something, but it hasn't been, to my surprise. I was prescribed medication. I probably should have already said this. I was prescribed Norco, thankfully, and I really do think it's the way that the graft was put on. Thankfully, because of that, there wasn't really too much pain at all, besides just stitches and it healing. I know a lot of you guys watching probably most likely have HS or know someone who has HS, and know the pain of that. It is nowhere near as painful as having a boil. So basically how it was described to me is that this graft is eventually the plastic itself is going to fall off and the skin will start to grow in place of the graft. The graft, my surgeon told me, was there to protect the flesh as a barrier within the first few weeks of the healing process, and then to promote healthy skin to grow. I knew that this is going to be a long recovery process, but at this point it was just what was needed. But I already feel better. I already have more, sadly, but I feel like I have more movement in my arm now than I did when I had like some of my like worst boils. So that was the healing process. I'm not working right now. I thankfully was able to get short-term disability for like the entire month of February for my job so that I could properly heal and go back to lifting 50-pound bags, which I can't even imagine doing right now. This video has been a mouthful, so if you have stuck it out till the end of this video, thank you so much. If you guys have any questions whatsoever, please be sure to comment down below. I've really been loving having conversations with you guys about this. It's me posting the first video was also the first time really talking to anyone besides a few close people about this, so it really helped me too. So you guys have been just been awesome, so thank you. So that is it. That's it. I'm not going to take up any more of your time. Thank you guys so much for watching today's video. Please like, comment, and subscribe if you like today's content, and I will see you guys next week.